Good afternoon. I'm Alan Unell, and this series of videos is called Healthcare Advocacy, where we confront problems in the healthcare system and then take actions to try and make a better system. Today we have a number of topics: pharmacy benefit managers, insurance cheats, a whole bunch of things. Anyway, before we get to it, down below in the YouTube description box, you'll find a link to the Healthcare Advocacy newsletter. And of course, you can subscribe for free and get these delivered daily to your inbox. But that link to that newsletter is the text for today's video. And all of the references and medical research studies and actions and actual healthcare references that I discuss, they're all in that newsletter. So feel free to subscribe. Let's get started. First, I want to talk about additional vaccines that may be needed for you. This week on Wednesday, I think that was October 23rd of 2024, members of the Advisory Committee on Immunization Practices, they support the government, and they're mostly volunteers, they voted to lower the recommended age for the pneumococcal vaccine from 65 to 50 and older. The ACIP members also voted to recommend that adults 65 and older get out there and get that second dose of the updated COVID-19 vaccine this fall. Eligible patients, of course, ask your provider for the best time to take an additional dose. Health experts say that older adults are more likely to experience the worst consequences of these viruses. So please take care of yourself and get the shots. And let me point out, my wife and I, we already did. So let's cut down on hospitalizations, go get vaccinated. You know, we've been talking a lot about Republican schmendricks. I like to call them regressives because they're not progressive, they are regressive. Anyway, in Orange County, California, a Republican stealing COVID funds got caught. Orange County, California, the first district supervisor, Andrew Doe, has agreed to plead guilty to conspiracy to commit bribery in federal court related to a scheme involving Viet America Society and the embezzlement, get this, of millions of dollars in COVID relief funds that was intended to help the county's most vulnerable residents during the pandemic. But people were stealing it. Anyway, as part of the agreement, he agreed to step down from the Board of Supervisors. You know, he belongs in jail. There's a link to the Mercury story for that. I want to talk about pharmacy benefit managers cheating. This is one of my favorite topics. The American Pharmacy Cooperative, that's a trade organization for independent pharmacies. So not places like Walgreens or CVS, but you know, like Bob and Mary's drugstore. Anyway, they represent independent pharmacies all over the country. They were reviewing the price differential paid to a North Georgia pharmacy and comparing it to nearby chain stores. The analysis they did earlier this year showed that the chain stores were paid well beyond what the family business was paid for many of the same medications. Let me give you an example. The chain stores received an average of about $54 for the antidepressant bupropion, while Bell's Family Pharmacy in Tate, Georgia, get this, $5.54. For a drug that's used to treat blood pressure, amlodipine, may be familiar to you, the chain pharmacies got $23.55. Bell's Family Pharmacy, $1.51. Now, by controlling prices and availability, pharmacy benefit managers cause patients and employers to spend more for medication, according to the Federal Trade Commission and pharmacy groups. On September 20th of this year, the FTC sued three of the largest PBMs, CVS Health's Caremark, Cigna's Express Scripts, and United Health Group's Optum Rx, which together control about 80% of the U.S. prescription drug sales. And there's a link to the FTC suit there. The agency said that they created a perverse drug rebate system, personally it's bribery, that artificially inflated the price of insulin and lots of other drugs. Each company denied the allegations. Good luck. Keep in mind that the largest PBMs also own drugstores like CVS. And of course, these other ones have mail order pharmacies. The lawsuit followed a scathing FTC report, I believe that link is in the newsletter, this past July, that said that the dominant PBMs often exercise significant control over which drugs are available and at what price, and which pharmacies patients can use to access their prescribed medications, if they're available at all. Pharmacy benefit managers will charge some health insurance plans more for a medication than what they pay the pharmacy to give it, keeping the extra money as profit. These guys are just scum. Anyway, the practice is known as spread pricing. Large PBMs also take money from drug makers as a rebate. Personally, it's a bribe to get their drugs on the preferential treatment list or formulary for health plans. And by favoring certain pharmacies with whom they have business ties, experts say, these drug brokers help force independent stores like Walz to close. You can find a link to the Kaiser Family Foundation full story on this. Look, this is because pharmacy benefit managers are motivated by making the largest profit as fast as they can, not by providing patients who need medication that medication. They are not motivated by your health, they're motivated to make money. Keep in mind that there is a complete lack of transparency there. Drugs are merely a vehicle to make a fortune, and the sad news is we the people let them. Look, let me go into this further because I want to dispel some rumors about universal health care, because if we had universal health care, there would be no pharmacy benefit managers. Universal health care is not socialized anything. When the American Medical Association decided to fight against universal health care, get this, in 1947, they marshaled the world's fear of communist China, which was brand new, and the Soviet Union, and called it socialized medicine. We can't let the government make choices about health care, they said. Then we would be no better than the communists. Well, they had another reason for opposing universal health care, and it was not rectified until 1965 when Medicare was signed into law. The AMA opposed integration. They did not want white doctors to have to treat black patients. Medicare changed that by threatening to withhold reimbursement for racist medical behavior. Well, that "it's socialist" meme is still out there, and we're hearing it all the time, since it's easier to hear a soundbite than it is to think through the issue. Let's think it through. Now we have private insurance determining what they will cover and what they won't cover, and there is no visibility to the consumer. They deny claims and prior authorizations without having to produce any rationale accepted by the medical community. They can use their own standards for denial. They do not have to rely on accepted medical procedures or standards or studies. What they are really doing is as non-transparent as it gets. They take every opportunity to make as much money as they can, holding on to premiums and not dispersing claims, because they are focused not on your health, they are focused on the health of their corporate investment accounts. Let's go back and look at pharmacy benefit managers. They implement the drug coverage for your insurance. They take bribes from the drug makers to put products on the improved list, the formulary, and then the drug companies have to jack up the prices to cover the cost of the bribes. They cheat the drugstores by offering below-cost reimbursement, because if the drugstore doesn't take it, they lose access to customers from that insurance plan, and that's their only hope of making a profit. They overcharge the insurance companies far more than they pay the drugstore, so-called spread pricing, and keep the difference. And the drug your doctor says you must have, well, you could be just SOL. That's shit out of luck. Anyway, they're not motivated by maintaining or improving your health. They're motivated by making as much money as they can. Look, universal health care like H.R. 3421, the vastly improved Medicare for All Act, does not fix everything. It does, however, offer transparency. What your doctor says you need is what's covered. Prices for all drugs will be negotiated so that manufacturers make a fair profit, and we the people don't get screwed like we do today. The insurance trust is operated in our interest to make sure we have access to the health care we require, not to make the biggest profit it can in the shortest period. Keep it in mind, we want transparency, not the veiled cloak we have today. Remember this, universal health care is public insurance paying private providers. Look, here's a bonus action we can take. I want you to vote accordingly up and down the ballot, and make lying wrong again. Just do that. That's what I've got for you today.@Thank you for watching. Down below, you can like, share, and subscribe. Send me comments either through YouTube or at healthcareadvocacy1@gmail.com. Have a good evening.